Interesting. There's a problem posting to Telegram right now, though. Telegram's not letting me post. Telegram is stupid right now. So I'm trying to let people know about the live stream. It's going to be a small live stream because not only is most of the USA asleep, but Telegram's being really annoying. Right? Telegram's being really annoying. So we can't. So somebody post in the Telegram group that we have a live stream right now because they're being stupid. But I'm gonna let Instagram story know. And ask questions. Okay. Instagram story knows. And Telegram does not know. Fuck Telegram, bro. Right? Fuck Telegram. Let me try again. Tamur, Yassine, what's going on? Trying again on Telegram. All right, Hadi, what's going on? Ayo Tunde. Carolina. Anila. Guys, you know what? Don't give the live stream a like. Let's keep the likes maximally low. All right? Let's keep the likes maximally low on this live stream. Nazanin. Guys, I was being facetious. Like, give the live stream a like. Mo, what's going on? Mustafa. That's good, Mustafa. Good to see things working out over there in Turkey. Somebody unliked the live stream. You're an asshole. I wish I knew who you were so I could block you from all channels forever. Suma, that's right. You retract that message. Yassine, do you have live chats on Telegram? I don't even think Telegram allows live chats. I've never heard of such a thing. Right? Telegram's dodgy. I still think my post didn't go through to let the live stream know. No, it did. No, it didn't. Yeah, one of you guys posted. My post didn't go through. Okay. Arij. I never do live streams at this time because the USA is asleep. I do them like 12 hours from now. Let's see. Arij, would you recommend doing NBME 32 2 days before the real deal? Yeah, 3 days before. Because you got to give yourself 2 days as a buffer just in case to review the whole thing, right? And then the day before your exam should be like no study. Okay, the day before should be very, very, very chill before your USMLE. So do it 3 days out. And then the second day out can be like finishing review of it if needed and just random custom review. And then the day before your exam should be very chill. S, you're planning on giving step 1 in May 2026. Could you please tell me the best way to plan my studies? I would want to know what you've done so far. Okay, like what have you done so far in terms of prep? Because the way you start USMLE prep is with questions, the free PDFs, and the YouTube videos that we have here. You can do the Anki, that's in place of the PDFs if you're not poor, but the PDFs are a good start with questions. So I'd ask what you've done so far. Okay, so you'd start with Mehlmanmedical QBank, untimed tutor random, 4 to 8 blocks of 10 per day. And then that's phase 1 of the day. Phase 2 of the day, after you finish that, is going to be your PDF /Anki / the YouTube clips here. That's your phase 2 of the day. If you guys are doing the Mehlmanmedical, minimum 4 hours per evening, like unprocrastinated hours. That's how you get the greatest score augmentation. Most of you can't read. So if you're going through the PDFs, they're 11 out of 10. That's fine. There's no problem doing that. But some of you will ask, like, if you're doing the Yankee, can that replace the PDFs? The answer is yes. Or you can just do both. Ayan, pro tip for step 2, C1 pass. Like, what are you asking? Hadi Chabaro, in anaphylaxis, do we give IV epinephrine? No, not for USMLE. It's wrong. I don't think they'll ask you that. It's always IM. It's always intramuscular epinephrine. One of my buddies who's an anesthesiologist said that, like, technically IV epinephrine is like the best. If it's like, yeah, sure, but someone's in anaphylaxis, like, you just punch them with IM epinephrine. That's like the very, very, very standard thing to do. It's probably a situation like if they're intraoperative, if there's a very rare situation of like intraoperative anaphylaxis or something, then like IV epinephrine would probably be done. But regardless, USMLE is not going to ask you the route that way. That's like a school of medicine thing. If your school of medicine asks you the route, choose IM, not IV. PPS Mort. For step 2, do you think we should do the question bank system-wise? The answer, okay, let me just keep reading. And do we do the questions topic-wise within the system? Because it seems to create a bias when I do topic-wise. It's annoying when you're prepping for step 2 because you do have to do them system-wise while you're going through your rotations, right? If you're on rotations right now and you're on, let's say, your PEDS block, like it makes no sense to be doing like other topics. So like you would do Mehlmanmedical QBank PEDS questions and simultaneously you'd be reading the PEDS PDF every evening, and you do the PEDS playlist on the YouTube, and then you do the 8 clinical mastery series, the 50 question NBME subject specific forms. You do all 8 of those twice prior to your PEDS shelf. If you're post-grad for 2CK, meaning you're not on rotations, there's no reason to do things subject specific. You can just do untimed tutor random from QBank, from Mehlmanmedical QBank. But I've articulated already. I know most of you guys probably haven't been in this live stream because it's different time zone. But I've talked about how within 2 to 3 months, we're going to have mini shelf banks released, okay, for 1,000+ questions in all this rotations. So PEDS, OBGYN, IM, EM, FM, neuropsych, surge. We're going to have 1,000+ mini shelf banks, and you can do those alongside 2CK3. So that advice is going to shift within 2 to 3 months, okay, where you could do, let's say, 2CK, Mehlmanmedical QBank random mode while you're on a rotation, but you do the PEDS 1,000+ question bank. You can do that. Trimbakesh, any specific strategies to tackle drug ads, annoying long biostatistics questions? Not really, because that stuff is sort of just improvisation and you'll handle it. Okay, it's the same for everybody. The only piece of advice I could really give is if you get a long drug ad, maybe you could flag it and come back to it if it's long. Okay, like if you have a big like research article type question where you're like, what the fuck? And it's like a triple question where you can't change your answer as you move type of thing. You could potentially just like look at your amount of time left on the block, flag the whole thing, and then just be like, I have to come back to this, because you're not going to know whether you have 12 minutes to read the annoying drug ad or whether you're going to have like 30 seconds and you pretty much have to guess. You don't know yet. So you can flag it, do your block the best you can, come, and you say, oh, I got like 16 minutes left. Come back to the drug ad and just like carefully do it. Okay, so that can be one tactical way to approach them. And long biostatistics questions, I mean, same deal. If you're spending like 45 seconds on a question and you're not making inroads, just flag it and move on. And then just be like, I'm going to have to come back to it. You keep that thing on the back burner. Okay, for any long question, it doesn't have to just be biostats, any long question that you're sort of hovering over, just flag it and come back to it. Summa, you have your exam October 16th in a month, okay? You did NBME 26, you got 67. How do I improve my score to 70 plus? Mike, okay, well, I said 65 is pass. You want 3 plus NBME, 68 plus for safety. And so I'm assuming you didn't sit any other NBMEs right now. So a month out is kind of like too much time to be spending all of your focus on the NBMEs at the moment. But it's like not enough time to like do anything else. Like, what are we going to say? Do QBank for a week? Like, what do we do? So like what we could theoretically have you do is sit like 20 and 21 offline. And if you get 68 plus, I would just have you sit the rest of the NBMEs and move your exam up. Okay, because as long as you're getting 68 plus the NBMEs, you don't need to be sitting October 16th. You could just get them all done with, 68 plus on all of them, and then you could sit by like the end of this month. That's what you could do. Rediet Tuckle. You're taking step 1 early October. Your exam is, or your NBME is 65 right now. What can I do to assure my score? You work full time. Well, if your step 1's early October and you're working full time, your focus needs to be completing NBMEs 20 through 32 and free 120 between now and then. That's got to be your focus. I would do 20 through 25 offline, free 120, and then 26 through 32 online. And you're just going to have to do those forms. And then also make sure you've done Mehlman high yield ARAS. Uriel Katsov. What's going on? Would it be better to focus internal medicine signals on small community programs to guarantee a match? I don't think that matters. I think that's a defensive attitude. Okay, so what matters is that no matter where you go to, that you rotate well, you're a team player, and you get a letter from someone at that institution. If your thought is like a smaller, more closely knit place is going to be less competitive, that's different. I'm saying it's a defensive attitude because it kind of comes from the underlying place that maybe you feel you're not competitive. Okay, so you just got to get a letter from wherever you rotate at. I wouldn't necessarily focus on the size of the place per se. Io Tunde, how many people have finished your QBank? A lot. A lot of people have done it. A lot. Not banks. We have step 1, 2, and 3 QBanks right now. I mean, I've said this like over 100 times, but there's people who literally like, it's a balance. Some of you are annoyed because you're like, you've talked about it a million times. You wouldn't believe the DMs I get. You wouldn't believe the DMs I get. Okay. There's like DMs, like people are like, when are you releasing your step 2 QBank? I'm like, what are you talking about? Like we've had our QBanks out for like months, like 2 months. We've had it like publicly launched, and I've announced it like daily in the YouTube. It's on, all the links are on the YouTube. It's talked about in the Telegram group. It's on my Instagram Reels. So, you know, Ariba, as a second-year student, how to start prep. Same deal as the person further up on the chat who was asking that he's got step 1 in May of next year, and he was asking how to start prep. I mean, it's the same thing. You got to start on questions. So it's the tetrad that you're going to do. Okay, so number 1 is Mehlman QBank, and number 2, the PDF/Mehlman Number 3, the Mehlman YouTube QBank, and then 4 is the NBME exams, but you're not going to do those until late. Abdullah, is Amboss QBank worth it for step 2 ? Where have you been in terms of like, is this the first point of contact you've had with Mehlman like content at all? Have you ever seen any of my reels? You clearly haven't been in a live stream. Have you seen any of my YouTube clips? Anything that I've put out? Is this your first point of contact to ask that question? Like I'm more interested in that. Like you're interested in having your question answered about like Amboss, and my question is like when have you first encountered my content? because I've talked about Mehlman QBank for like 2 months. Carolina Secon. Everyone hit the like button. Thanks, Carolina Secon. Taymur. Faz. How did you first realize that the NBMEs and USMLE questions were the same? Like, how did you make the connection? People will swear by UFAP, LOL. Answering that question, I mean, I've had anecdotes for like a decade. It's not like one thing. I basically, the number of anecdotes I have and the number of stories I have about how I know the questions are the same is borderline like not okay to talk about on a live stream. But let's just say like I've had like a number of anecdotes over the past decade of like questions not only being the same between, you know, let alone the old NBMEs versus the new NBMEs and the comp forms, but with the real USMLE, like people who've had, and myself, that have had questions the same distance apart in the same blocks on the exam, the same, you know, was your third to last question on the exam this X-ray with an arrow pointing to this? Yes. So it's like, oh, so not only is it the same questions, it's the same like block, the same location in the exam. So they reuse like actual blocks, entire blocks, not just questions. And did you have these two questions 10 questions apart in the fifth block? Yes. Okay, so it's like we've had anecdotes like that. Questions are all the same. These things aren't complicated. You guys give like the NBME way more credit. Like you have no, like you understand that they're just like busy random attendings that like have shit they're doing and they're disorganized. You understand that? These aren't like deities up in the clouds. These are like random like 64-year-old attendings that are like busy doing shit and they're disorganized. Sabika. What's going on? Sabika. Thanks for being a member. Tamor. Can I swing biostats? That stuff really doesn't click in my test in 3. Do you mean can you wing biostats? You can't wing biostats. But, and you shouldn't study for it. You shouldn't cram for it, okay? Don't study within a very acute time frame for it. You need to longitudinally study biostats. It's one of those subjects, annoyingly, that you have to like do questions and then sleep on it. And then you wake up the next day and you somehow get it a little bit better. And then you sleep on it again and then you get it a little bit better. It's like it requires many REM cycles over a long period of time to get better at biostats. You can't cram biostats. So whenever someone tells me that they're like not doing the biostats questions in QBank, like they're not checking those questions, that they'll do them later, bad fucking news. Okay, it's not what you want to do. Football King, passed your step 1. You just watched my YouTube videos and went through all of my PDFs. Thank you so much for everything. Thank you, Football King. Anjali, when reading explanations, should one understand what they are asking or thoroughly try to recall and memorize all facts given? No, you're just going to read without trying to memorize. So you're not going to make annotations or notes. You're not going to make your own self-Anki from QBank. You're just going to read. You say, well, I'm going to forget things. That's fine. It's okay. You can forget things. So let's say you only remember 25% of the explanations. That's okay, because if it's high yield, it's going to show up again. If it's a question on like Duchenne or cystic fibrosis, hypertrophic obstructive cardiomyopathy, like you're going to see these questions again and again and again, even in our QBank. Okay, so if it's an obscure condition, we're either not going to ask it in the first place, or you're not going to encounter it again. If we very rarely ask something more difficult, it might be like a one-off, and that's how you get like an NBME of like 90%, and that's okay. You get a weird brainstem question, you know, like maybe you won't encounter that same thing again. It's okay to get that wrong. Faris Tabal. How do I differentiate between the different causes of chest pain, MI, pericarditis, etc.? It's a long seminar. They're completely different, those presentations, okay? Does everyone know how pericarditis pain presents? If you don't know how pericarditis pain presents, you're not going to pass. I think most of you know how pericarditis pain presents. Okay, so it's pain that's worse when you lean back, better when you lean forward. Some of you reverse that. Okay, better when you lean forward, worse when you lean back. So they'll walk through the door bent over at the waist. That's a presentation for family medicine, especially because they're leaning forward. OMG, they're bent forward at the waist. Okay. It's a long seminar talking about like pericarditis, MI. And also costochondritis. Okay, that's an important one as well. If they tell you there's pain reaching behind your back over your head, that's clearly MSK, costochondritis. You got things like viral pleurisy, you got pleurodynia. There's other causes of chest pain that can be misconstrued. Mitral valve prolapse syndrome, that's 2CK3 level in particular. Mo, what's the optimal time I need to prep well and aim for greater than 270 plus on 2CK? I had my step 1 last September with a high with an NBME score of 30 of NBME 31 of 66%. Your highest NBME was 66%. If your highest NBME was 66% for step 1, you're not going to get 270 plus on 2CK. The only way that's possible is if you vastly undershot yourself on step 1. I don't even know how you pass step 1 if your highest NBME was 66, because it passes 65. It means you pretty much got lucky. It means like you went in there and you just happen to get a 65 on the real deal internal score, and you passed by a question without you knowing. Never sit the USMLE if your NBMEs are like under 65 is the floor. The floor. There's been people where they'll be like, oh, I got 73 on free 120 and I got like a 69 on my last NBME or whatever, and I failed, and they're like shocked by it. And it's like, well, not really, because you had an NBME that was a 63 like 2 weeks out, and like that's a fail, and that's possible in your exam, right? I've seen these things. It's like, why would you sit if you failed within 2 weeks of the exam? It's stupid. I have people postpone an entire month. Let's say you're postponing an entire month, you'll do Mehlman QBank, then come back and you'll be like at least 7 to 10 points higher on the NBMEs. Ilya, Dr. Mike, how to remember all the high yield nephrotic versus nephritic syndromes? I'm struggling with remembering all those concepts. Can you explain it very clear and simple? Again, it's a lengthy seminar. Let me see. Chat just moved on me. Let me scroll back up. Let me see. Okay. Well, you just have to know the high yield conditions. It takes enough practice through questions like membranous glomerulonephropathy, nephrotic, renal amyloidosis, nephrotic, diabetic glomerulosclerosis, nephrotic, minimal change disease, nephrotic, focal segmental glomerulosclerosis, nephrotic, PSGN, nephritic, IgA nephropathy, nephritic, Alport syndrome, nephritic, membranoproliferative glomerulonephritis, nephritic, diffuse proliferative glomerulonephritis, nephritic. So you just have to have like enough experience with questions. That's kind of how you have to do it. Memorizing whether a renal condition has blood in the urine or not is exceedingly high yield for USMLE. That's like a very important thing you should do, is like know which conditions have blood and which don't. Like especially for peds. If you get like an 8-year-old and there's no blood in the urine, it's not PSGN, it's not IgA nephropathy, right? So Prem Kumar, as you mentioned, 250 is the new normal in your previous videos. What's the best study plan to score 260 plus? You recently cleared step 1. Yeah, I was saying that like when I sat step 2, I sat my exams back in 2012, 2014, and the average was 232 on step 2 at the time. And getting a 260 was like a big fucking deal. Now the average is like 250 and like everyone gets 260 plus. And it's like, you don't have to be smart to get a 260 plus now. I'd say getting a 270 plus now is like the start of like, okay, that's impressive. Okay. But back when I sat, if you got a 260 plus, it was a big fucking deal. But the average was a 232. Now it's the average is like a 250. I don't know what they're doing in terms of their internal scores. I don't think it's just that people are preparing better. I speculated that at one point, but you have people who are not smart, who like are managing to get like high scores, and it's like, you're not smart. Like, you're not going to score like that. So they changed their scores, their scales internally. Yassine, what time it takes from starting till the match? And by the way, when I sat, there were people who were like years before me who sat where getting a 240 was a big deal. I'm not joking right now. People were like, how do I get like in the 240s? I'm not kidding. Okay. Asif Hassan, how to improve NBME scores? S. I'm an Indian IMG and I've just finished second year. So I finished studying Path, Micro, Pharm recently, but I've forgotten a lot of anatomy. Physio, biochem, do you think it's too much time for prep? No, just study random stuff. I'd want to know when your exam is. S. May K. Step 1 early October. Did maybe 26, 27, you got 75%. Will I be ready? Feels like I'm guessing a lot. The answer is yes, you're ready, because those are high scores. I said 65 to pass, 68 plus on 3+ NBMEs. Safe. So those are high scores. And just do the other NBMEs and have consistency. May K. Muhammad. Al-Haimi. What are the chances of matching with 5 years post year of graduation with average step scores? Not high. How important is U.S. clinical experience if I have none? Not going to help you if you don't have it. Applying broadly for IM, yeah. I think that's a smart move. You can't have entitlement. You can't have entitlement. So as I've talked about in my recent content, my reels, you have to apply broadly. IM, EM, what the fuck am I saying? FM. EM wouldn't be easy. EM's actually hard. You have to have experience, certain experience with EM. You're going to apply FM and IM, transitional years, prelim years, apply broadly. Okay? And for your graduation 5 years ago, you need to have step 3 as well. You got to take step 3 before the match. You got to prove recent competency. Your chance of matching is not high because they don't want to retrain you. So it's like, if you've been out of med school just sitting, that's not good. If you've been like a doctor in hospital, that's also not good, because you're going to be set in your ways and you're not going to be as open to the pedagogy of the course the way you need to, of the program the way you need to. In other words, you'll go in there as an intern, but you're like a doctor 5 years out, and you're going to be like, I'm not listening to this like young doctor second year out. I know more than them. They don't want to deal with that shit. So that's why it's a disadvantage. But you'll apply broadly. Oklahoma, Wyoming, Montana, Alabama. Apply broadly. Go to Alabama. Go to Mobile, Alabama. Okay? You're not going to match into Einstein in New York City. Not going to happen. Okay? You're not going to match at Brigham Women's Hospital in Boston. Not going to happen. Okay? Let's get political. Okay? Red versus blue locations, right? That's a good way to attract followers. Hannah Solemn. Hey, you mentioned in a previous live stream that people don't know how to read. That's correct. So how to actually read, in your opinion? I can't train you how to read the same way I can't train you how to do math. Right? So, but that's why there's entrance exams to medical school. There's a certain floor. But I've said that the application to study is that's why we have the Mehlmanmedical. For those of you, that's going to help with your retention versus just the PDFs. So a lot of you can sit with the PDFs and then you read a page and you're like, I don't remember anything I read. But then if you do the Anki, you can like see a card 9 times and you'll actually maybe remember it. Bhaskar. Hey Mike, how much to aim for in UWorld QBank for step 2, 270 plus? Same with the other dude who asked about like Amboss before. My question to you, Bhaskar, is this the first point of contact you've had with Mehlman content? Like, are you just like dipping, like how did you enter this live stream and not know that Mehlman has QBanks? Like, how did you not know that? Right? So I'm not really concerned about your UWorld. That's not really my concern. I've got other things to be concerned about rather than your little UWorld that you do. We've got Mehlman QBanks. You've got to evolve. There's better things you can do now. This is the end of 2025. Oh, not the end, but we're getting there, right? Gabby, do rotations in other countries count for a good match? Probably not. They don't care. 2CK is what matters the most. And then if you do a rotation somewhere, it's just if it's from a letter from someone they know. And if you rotate at a location, they remember you. That's obviously important. Muhammad, you took a year to study for step 2. You averaged 240s, low 250s, self-assessment. What advice do you give to maximize your scores for 260s in 1 month? Just if you have 1 month, just focus on the NBMEs. 6 through 8 offline, free 120, 9 through 15, and make sure you do all the CMS forms. Muhammad, you're preparing for step 1, you stopped, you decided to do a revision on UWorld, but you feel you forgot everything. That's unfortunate. It's unfortunate that you forgot to do, or that you decided to do a revision on UWorld, but you forgot everything. That's unfortunate. Athman, I do 7 blocks, random exam mode on Sunday. How is that being patronizing toward people who like do other QBanks? How's that? That's good for like maintaining followers, isn't it? Just be patronizing. I was patronizing towards some dude who like, I'm not even gonna get into it. Let's see. Pentop Gaming. Is class rank important even for IMGs from med schools outside of the US? It's always important, class rank. 2CK, class rank, and your letters from people that they know. Muskin, how should I balance learning for patient care during rotations with high-yield exam preparations that I can excel both clinically and on the, okay, I know it's 2CK. The answer is just study for the USMLE. You got your entire life to be a good doctor. That's a dilemma that people deal with when they're on rotations. It's everybody. It's every single person. It's even step 1. Like if you're trying to balance studying your bullshit PowerPoints for school that they have, the lectures they have, versus like step 1 stuff. I mean, it's the same thing. But you'll literally be on a clinical rotation, and rather than just being like, you'll have the opportunity to literally like do ward stuff, like actually learn clinical stuff. And you're like, this is great. But if I do that, then I'm not gonna be able to study for USMLE. I'd rather do questions. And my response is just do questions. Yes, it's stupid, but you need to do well in your exams. That's the game. The game is dumb. That's the game. Okay? The game is conformity and just doing well in your exams and not learning clinical stuff when you're in med school. It's just doing questions. Scroll back up. From your experience, what specific habits separate students who just passed step 2 from those who scored 2 scores? Oh, that's not habits. That's IQ. Okay. But if your question is going to be like, what's going to separate people who, let's say, It's pretty much just IQ, to be honest. But you should study hard regardless. Like, you should never take a day off. I'm not a fan of taking days off. I think like gym 7 days a week, study 7 days a week. That's mandatory. Okay. It's not a politically correct answer, but like, what answer do you want? Because that's the truth. Like, some people are reaching, and for other people, it's like easy. Should I take NBME 32 as well? Because I have a fear if I score low, I would lower my confidence level. You scored 69%, and maybe 29, exam in 10 days. Obviously, if your exam's in 10 days, you're going to do all the NBMEs. Okay? You have to have confidence and just do the forms anyway. And if you score poorly, then just postpone. You don't want to be avoidant of the NBMEs. That's not going to help you. Zane, 67% and maybe 28, 66% maybe 29, 63% and maybe 30. Okay, so you failed 30. And these are scores now, exams on September 30th. How should I improve score to 70 as I'm hovering around 66, 67? I'd want to know the the dates of all of those exams. I'd want to know how you reviewed them. I'd want to know what you did for QBank. I'd want to know how rigid of an exam date that is at the end of the month. So there's a lot more I'd want to know, because I don't like the 63. It's not a good idea to be getting close to your exam where you get a 63, which is a fail. That's not good. It's precarious. So I would need more information. The dates of all of your NBMEs, how much QBank did you do? How rigid is that exam date? Can you postpone a month? You're like, well, I don't want to postpone a month. That doesn't sound good. Cool. Well, then just do 68 plus, get 68 plus in all the NBMEs that you do from here on out, and you don't have to postpone. But if you sit another NBME and you don't pass, you have to postpone a month. And you do Mehlman QBank for an entire month. Then you come back and do the NBMEs again. Vic, how do I remember what's diagnosed clinically and what needs confirmation imaging or labs? Practice, questions. Like, for instance, you do questions where like disc herniation is the diagnosis, and you need to know that we no longer x-ray for that. You don't have to do x-ray. You don't have to do MRI. Those are wrong answers now. No further diagnostic studies indicated. Okay, if you have motor sensory abnormalities, sensory is not, they're not talking about radiculopathy. If you have like numbness, you have motor dysfunction, loss of reflexes, then you can do x-ray to rule out vertebral dislocation. Bell palsy, you can just, no further diagnostic studies indicated. Is half the time the answer. Half the time that won't be listed, and the answer will be like Borrelia titers for Lyme disease can be an answer. So it's just questions and practice. Afteal, do you think it makes more sense to do the electives first or to appear for the step 2? I don't think it really matters. Okay, like your knowledge when you're on electives, unless it's like dangerously bad, they don't care. And like, let's say you're very, very knowledgeable and you go into some elective somewhere, okay? Whatever knowledge level you have does not impress them. Because they're like so far ahead of you that like, even if you're knowledgeable, they don't care. It doesn't impress them. So like, it's just about not being like dangerous. Like, it would be bad if you like went into an elective and like you didn't know what like cortisol is or aldosterone. They'll be like, what is aldosterone? Like, imagine going into like a visiting rotation or something, and then they're like, yeah, we got a patient with Conn syndrome, and you're like, oh yeah, and they're like, do you know what Conn syndrome is? And you're like, that would be real fucking bad news. You wouldn't even pass step 1. First of all, you shouldn't pass step 1. But that's how you would fuck yourself over if you're dangerous. If they're like, you don't know what Addison disease is, okay, but they don't expect you to like, you know, they're not going to be like, oh, you know, the metirapone testing versus like Synacthin, like that stuff's more involved, and that's fine. They don't expect you to be an expert. They just expect you to like not be dangerous. right? That's why you have the licensing exams. But if your question is like, do you need to do step 2 first to somehow like be impressive on your electives? The answer is no. You have to be a team player, have humility, not talk too much. If you're a female and you're assertive, that's no problem. If you're an assertive male, you have to keep your mouth shut in the medical environment until you're more senior. Okay? I hated that when I was in med school. I was very knowledgeable and very assertive and alpha, and that caused problems. So like if you're an assertive male, and especially if you're smart, just keep your mouth shut. Dr. NK, sir, in one of your clips, a patient with congestive heart failure is on diuretics, how to differentiate between pre-renal, renal with FENA. Will not the diuretics affect sodium excretion? You need to know that diuretics and chronic left heart failure are known causes and high yield causes of pre-renal. So when you start getting into the side discussion of like, how are the diuretics now going to affect the kidney where this now changes our FENA, don't get into that. That's overthinking. It would just be a situation where it's like patient's been on furosemide. Patient has chronic congestive heart failure with systolic dysfunction. And you would need to know that that's pre-renal azotemia with a FENA under 1% and the BU endocrinity ratio greater than 20. You don't want to overthink that stuff. There's a difficult 2CK free 120 question where it's acute exacerbation of heart failure, and that's how it was acute tubular necrosis. That's very, very difficult. That's why we emphasize chronic heart failure for pre-renal. Okay, but you can have unstable acute heart failure, and that can actually be acute tubular necrosis. If you don't know what I'm talking about, it's more just that if you have acute drop in perfusion of the kidney, exsanguination, blood loss, arrhythmia, like a ventricular fibrillation episode in 30 seconds, an NMI. You have acute drop, someone during surgery needs 30 packs of blood. If you have acute drop in perfusion of the kidney, that's not pre-renal. That's acute tubular necrosis. That's high yield that you know that. Pre-renal tends to be more subacute to chronic. Okay, it can be like vomiting, diarrhea over many days, pre-renal. Diuretic use, NSAID use over many days to weeks to months, pre-renal. Chronic congestive heart failure, pre-renal. But acute blood loss, exsanguination, blood loss during surgery, arrhythmia, that's acute tubular necrosis, not pre-renal. It's high yield. I've harped on that in my content. Ayesha, you're planning to take the exam first week in December. Was there a question with that? Kyle, good to see you again. 76% on your step 2 QBank first pass. Time for incorrects or proceed straight to CSM, the CMS forms, you mean, and NBME. Yeah, you can go to the CMS forms. You only need to remediate with incorrects if we eventually get you to 9, 10, 11 NBMEs online and your scores aren't where we want them to be. So what you've done is you finished Mehlman QBank. Now you would do a first pass of all the CMS forms. Then you do 6 through 8 offline, okay, NBMEs. Then you would do a second pass of all the CMS forms. Then you do free 120. Then you do 9 through 15. Now, only if your 9 through 11 scores when you eventually get there are poor, then we could have you remediate, let's say, with not necessarily poor, just subjectively poor. Like let's say you want your 270, but you're getting like 246. And you're like, no, I want to remediate. Fine. You could go back to incorrects. Okay. But otherwise, you just progress 12 to 15 at that point. Kyle. Global. LFTV. You're starting from scratch for USMLE step 1. Can I start with your PDF straight away or I have to build basics? No. What do you mean build basics from other resources first? What does that mean? I never understand this logic. So like, what are you going to do? Sit with Robbins? Sit with Harrison's? Is that your idea of like building foundation, quote unquote, before doing Mehlman PDFs? Like, what are you asking? You're like, should I avoid the USMLE resources that are best by reading bullshit? Because that's going to help me what are you thinking? What are you thinking? Okay. And I'm responding this way to you because it's like, you got to straighten your head out and like be focused and like be logical. Artificial muse. Should I do NBME 6, 7, 8? The answer is yes. I said 60, 15, and free 120. Mohammed. Someone finished a QBank a while ago, but had to take a break. Now decides to resume studies. NBME is enough for revision? The answer is no. Or should I do a second pass? Yes. You do Mehlman QBank at this point. Yum Yum Coca Puffs. That's a cool name. Where were you in the process when you decided to? What do you mean to quit? There's no quitting. It's more like understanding that I have better opportunity. Okay. I mean, I'm not going to compare myself to like Zuckerberg or something, but it's like, people will drop out or like people. I mean, I finished med school, but I'm saying like, I knew that I was going to do better things than just like work in a stupid hospital somewhere. So after I graduated med school, I moved to Japan. I did a Japanese immersion school here. And I was always doing word of mouth tutoring, but then that just grew. Bezad, doing your Anki PDFs modules, QBank for step 2. I did the audio QBank completely for step 1. Should I do it again? You're doing the QBank for step 2. You can do the step 2 playlist, the YouTube, I think is what you're talking about. You're doing everything you need to do. Okay, if you want to watch the YouTube clips again, I'm not going to protest that. Bazad. Sufi, thanks for the super comment. I have no idea what to do for genetics, but I find your PDF very difficult without a background. What should I do? I would do the PDF anyway. This is why there's like entrance exams to med school. Like, didn't you take genetics in undergrad? Don't you know what a cell is? Don't you know what like autosomal dominant means? Don't you know what like, I'm not trying to be patronizing, but like, what do you mean without a background? So do the genetics PDF. Do our QBank with genetics questions in there. Do the path PDF. We also have review of genes in there. Scrolling back up. Scrolling back up. Mike, I'm doing bio. If I skipped you, sorry. Nicholas, you're doing biochemistry for step 1. You've struggled with it since year 1. I know majority is superfluous, but can you surely recap what concepts are must known? Honestly, just look at the biochem PDF that we have. It's high yield enough, right? Molecular biology, ubiquitination, whether enzymes are like metabolic enzymes are active or inactive in the fed versus fasting state, right? I make a lot of YouTube clips on that stuff. So there's going to be some nitpicky things that show up, but I'd say it's mostly knowing metabolic enzymes active versus inactive in certain states and basic like organellar function, like your lysosomal storage diseases, glycogen storage diseases, ubiquitination, as I mentioned. All right, I'm going to just skip through some of these questions now. Let me see. I'm a Pakistani IMG. Oh, hey, Jana, if you're still in the clip. Doing a 9 through 14 group. Yeah, you said that. What about 15? You want to do 15 as well? Okay, there's a 15 for 2CK. Jana, you want to do that? I'm just skipping through some of these questions. So I got to go. I got to go to the gym. It's Yazan. Good to see you in the different time zone live stream. How to improve my ability to retain information from reading? You can't. You can't. It's your verbal IQ. Right? Safe Abdullah, if I have a strong base in medical school, is QBank questions enough for step one? Maybe. Like, yes, but I still like recommend a more broad study plan. Okay, like you can do QBank only. You could do like half of QBank only and score high enough to pass step one, but it doesn't mean like that's what I would recommend. Like I would still recommend doing QBank, giving the PDFs a read, going through like at least a few hundred of the YouTube questions that we have, do the NBMEs. Like I still recommend that. It's more broad diversification. Champion. Is it normal to feel like sleeping is a waste of time? Yes. When one is really focused on some task, absolutely. Sleeping is the biggest waste of time and annoyance. Absolutely. I think about that all the time. Patrick, yay. Dr. Mike, do you think class rank really matters for IMGs? Or should we just focus on steps? Thank you for everything. 2CK is most important, then your class rank, then your letters, and your personal statement. Okay, when I say letters, I don't mean some bullshit like random letters, people praising you. When I say letters, I mean if you happen to have a letter from someone at that institution you're applying to, then that is going to be important after your 2CK and class rank. Otherwise, it's just your personal statement. The personal statement, this is important, guys. The personal statement is never going to galvanize and excite a committee where they say, wow, this person sounds so amazing. Let's take them. That's not going to happen. Do you know what the purpose of the personal statement is? Do you know? It's to weed people out who talk about themselves, who come off like they're solipsistic and not a team player. I did this. I did this. I published this. I did this. I did this. We don't want you at our program. Maybe you're a super nice person, but like not in your writing. So you just want to like basically talk about how you've worked with teams, how you want to help a team, help a community, contribute to a community. It's not about you. That's what the personal statement's about. I'll answer one more. Alex Aika. You think step 3 score can save an average step 2 score for US grad in their prelim year? Yes. In their prelim year. Yeah, it can. They would definitely look at that. It's your most updated stuff, Alex Aika, that they would look at for sure. Because if you're in a prelim year and you're applying again, oh, absolutely. Everything is going to ride on like what you've done during that intern year. 100%. 100%. So the step 3 score would matter. Any letters you have during that prelim year, even though it's like so early, like you apply before you even like through the year. So it's a bit odd, but you would need a strong step 3 score. You know, a prelim year really sets you up to like rotate at that program. That's what it sets you up for. I'll answer one more. Val D. How can I improve my accuracy when I'm stuck between two answers 50-50 and avoid picking out a familiarity or tunnel vision? I've inculcated that when you don't know an answer, don't choose weird sounding shit. Okay. And when you pick an answer and you don't know an answer, don't change your answer. Okay. So sometimes the answer really is just Cryptosporidium parvum, not Isaspora belli. Okay. Sometimes the answer really is just ITP, not pseudo great platelet syndrome. So don't choose weird answers. And if you're reading an answer or reading a question and you choose sickle cell, you're like, sounds like sickle cell, sounds like sickle cell, sounds like sickle cell. Then you see the answers and you're like, ooh, thalassemia. Wrong fucking answer. Okay. It's sickle cell. So don't change your answer when you don't know the answer. Don't choose weird sounding shit. I see this all the time. Like students I have on Zoom, when they're hovering on a question, it's like a simulation thing. I can predict it. Like choice D will be something really fucking weird. And I'm like, they're going to choose D because they don't know the answer. And they choose D. I'm like, have you ever heard of that before? And they're like, no. I'm like, why the fuck did you choose it? All right, guys. I was experimenting with a live stream during this time. Maybe I'll do another one during this time.